Crucial research has been taking place in the city since last summer to try and better determine COVID levels in Toronto, and that's aside from nasal swabs and spit. It's actually testing our wastewater at places like the Ashbridges Bay treatment plant. That data is then transferred to Toronto Public Health, but what happens to it at that point is still in question.
It's a complementary tool to track the amount of COVID-19 that's in the community.
Researchers are taking a close look at what's being flushed down our toilets, knowing symptomatic and asymptomatic people shed the virus in their stool.
Everybody needs to go to the bathroom, whereas with the clinical testing, a person needs to physically go to a testing center and get tested.
Toronto Water has provided access to all 4 of the city's treatment plants for different research projects. Ryerson has been part of a province-wide initiative with other universities since the fall. Samples are taken 3 to 5 days a week and sent to labs. Toronto Public Health then gets the results, but the information and what it's used for specifically isn't being shared by officials.
How is Toronto Public Health using that data exactly?
At this point in time, given that it is research data, it is used to substantiate our primary data, things like case counts and case rates, the reproductive number, percent positivity when it comes to tests.
That's the goal of all of this, is to provide them the information and to help have discussions around how to interpret that information.
The University of Ottawa tests wastewater for COVID daily and provides same-day results to public health officials there. That information is also made public.
This is an additional measure that is taken into account by public health units, together with the clinical picture, the clinical cases that are happening in that community.
In a statement to CityNews, OPH confirms over the last 3 months, sharp increases in wastewater virus detection have almost always preceded an eventual surge in lab-confirmed cases and increased community transmission and outbreaks. As the third wave hits, Torontonians don't know if that uptick was seen here, as that information isn't being shared.
You see, I think, a good correlation between what the wastewater surveillance is seeing and what the clinical case information is seeing. So I think it is a reliable method.
When I asked Dr. Davila why she isn't making the wastewater research information available publicly, she simply said that the data doesn't belong to Toronto Public Health and it's not for them to share.